All right, we're talking about pioneering value-based healthcare. I think at Mayo Clinics they've started, you, as one of the people who was in front of that, with something like value-based healthcare, but it wasn't called value-based healthcare back then. Could you elaborate a bit on this?
Yeah, before value-based healthcare became known by value-based healthcare, entities like Mayo Clinic were involved in trying to deliver an integrated care process that offered the highest quality at as low a price as possible. And it was some of the things that really are the underlying infrastructure for value-based healthcare include integrated practice units, which the whole Mayo Clinic is a single integrated practice unit. Bundled payments, for example, a part of value-based healthcare, require an integrated practice unit that has a focus on a single disease. Groups at Mayo Clinic have been doing this literally for 100 years. We didn't call it value-based healthcare, but the net result of that coordinated input from the diverse perspectives, including not just physicians, but other providers like physical therapists and nurses, and all of the infrastructure created an environment where an exchange of ideas led to new care models.
What brought about this change of the way people worked at Mayo?
Well, the Mayo brothers, Will and Charlie Mayo, worked as a team. To give you an indication of how closely they worked as a team, although they were brothers, they had a single checking account. Now, that's a position of trust that, you know, I mean, some men don't even share with their wives, for example. But I think it shows you that how important it was for the founders of the Mayo Clinic to be able to work in a relationship of trust as team members. And they recruited then others to join them who also bought into this model of care that was team-based and expanded to include all of the nursing staff, the allied health professional staffs and all. So it was literally in the DNA of the organization from the very beginning.
Over the years, Mayo has evolved into an international multi-million-dollar hospital. So how do you keep this atmosphere of trust alive in such a big organization?
The primary value of Mayo Clinic is the needs of the patient come first. And that literally drives everybody's actions every day. A few years ago, there was somebody who came to the Mayo Clinic in Rochester and was trying to understand the culture of the organization. And after the Mayo Clinic building had closed one day, he was walking through a lobby and somebody from the janitorial services was cleaning up, and this individual stopped to ask this person, you know, what are you doing? And his response was, I'm saving lives. Why did he say that? The needs of the patient come first. He's making this place clean, and so there's lower the risk of an infection for somebody who may be immunocompromised, whatever. The point of that story is everybody at all levels of the organization understand that the needs of the patient come first.
And how do the patients themselves are involved into this model?
So patients have been involved in many, many ways. There are patients who are grateful donors and have done a variety of things to help others on their patient journey at Mayo Clinic. One that I immediately think of is a grateful elderly patient who donated a Dale Chihuly glass sculpture that is in the entryway of the new Gonda building. I mean, it's a fixture that is just uplifting as you look at it. And so patients, not only through their generosity for contributions like that, but in support of either the clinical practice, research, or education, which are integral parts of Mayo Clinic, have created the environment in which a patient-centric approach to care has been allowed to flourish.
Right now, we've seen value-based healthcare develop a complete, intricate, theoretical, academical framework. It spreads across the globe. What do you see value-based healthcare go from here?
I think it's critical, particularly in places like the United States, and I'm happy to say that, I've been engaged in the Netherlands through Vital Health Software as well, but that this transition from, a fee-for-service or pay-for-production sort of environment move to a pay-for-performance environment. And that's really what value-based healthcare is all about. There are going to be missteps along the way, but there's no question in my mind that this is the right journey for the U.S. healthcare system, and I believe globally for healthcare systems to be on.
Because
it changes the focus. It actually, the needs of the patient come first. It puts the patient, in my opinion, at the center. The value equation, value equals outcomes over costs. The outcomes that really matter are the outcomes to the patient. The old joke is that the surgeon comes out and tells the family the operation was a success, but the patient died. Well, the value of that in value-based healthcare is actually zero. And so this shift to a patient-centric metric, I believe, will actually help ensure that what we do in healthcare is actually meeting patient needs.